Robotics in joint replacement surgery allows us to give you a truly custom and personal approach to joint replacement. But first off, what joint replacement surgery with robotics is not is some Terminator machine off doing your surgery while your surgeon is just casually off in the corner of the room. That's the first and foremost thing to know is you are still having a human being performing your surgery. We just use robotics as a tool to customize the approach for how we do a hip or knee replacement. Traditional surgery around the hip and knee focuses on the anatomy, and we assume that everyone has identical anatomy. We all know that that is not true. There are variations, and everybody's just a little bit different than everybody else. So with robotics, we get a CT scan before surgery, so we have very precise bony anatomy noted. And then during surgery, we can do certain techniques that allow us to incorporate your soft tissue anatomy, such as your ligaments, your capsule, muscles, things like that, that make you who you are. And then we can customize how we put those metal replacement parts in that is customized just to you. We cannot do that without the assistance of robotics. The computer assistance during the robotic surgery is pretty much the better half of the equation. So robotics is the physical robotic arm that we can use for precise and accurate placement of the parts. But with the computer, that is how we can assimilate your soft tissue anatomy, like your ligaments and muscles, and customize in cyberspace how your body is going to behave with that new joint. And with that information that we get from the computer and the CT scan, we then can use the robot to precisely, accurately put those parts in. People often ask, what are the benefits of utilizing robotics and computer assistance in joint replacement today? Well, it does make it less invasive. So what do we mean by less invasive? Well, any procedure that we do in medicine, there's a certain amount of damage that we have to do to get into the joint. We have to cut your skin. We have to open the soft tissues down to where your knee or hip are. So what we can do to try to minimize the amount of damage we do is be precise and accurate with how we place the parts and do the minimum amount of bone resection necessary. So for example, a traditional knee replacement, if we assumed everybody's anatomy was correct and all identical, we would cut the metal parts in a standard fashion, and if it doesn't fit quite right, we'd have to strip a ligament here, maybe do some soft tissue work there. That increases the amount of damage that we have to do to perform your knee replacement. So if we can have that information and not have to do those soft tissue releases by altering the geometry of how we put the metal parts in, then that's less invasive. And what does that do for us? Well, it makes those incision sizes a little bit smaller. It increases how quick you're returning to function, such as playing pickleball or getting back to work. And it also lets you get out of the hospital sooner.